My next guest calls last week's healthcare summit, quote, helpful, but says there are several things President Obama needs to include in the latest proposal to make healthcare overhaul a reality. Ken Thorpe is the executive director of the Partnership to Fight Chronic Disease and a former assistant secretary for health policy at the Department of Health and Human Services. Ken, great of you to be here. How is what we're expecting to hear from the president this afternoon really any different than what the Democrats have put together to begin with?
Well, I think as you heard, that the president is going to add some new provisions in that are really part and parcel of what Republicans have been talking about for a while. More opportunities for really doing medical malpractice reform to start with, being more aggressive in weeding out fraud and abuse in the Medicare and Medicaid program, increasing what we pay providers in the Medicaid program in order to get people who are on Medicaid actually in the physician's offices to get treatment. So that and including health savings accounts, a main part of what Republicans have thought is part of the solution for controlling health care costs, that these HSAs would be included in the insurance exchanges. So I think he's moved as far as he can go, given where they are right now. All these provisions, I think the White House believes, would improve the bill.
How does the president's plan, though, bring down health care costs? That's the central question that every American has, and that there are very few answers for them.
Well, the issue of, that is one of the issues that people are looking for some clear answers. I think they could do more on controlling the growth in health care. The good news is that there are pieces, they're moving in the right direction. They have the foundation in there in terms of changing how we pay health care providers, really doing a better job of working with chronically ill patients. But we have to remember that 75% of what we spend on health care is linked to chronically ill patients, and we need to put in place a system to keep those patients healthier, keep them out of the hospital, and keep them from being readmitted. We need to do that nationally in the Medicare program. I think that's a change that would attract bipartisan support, and that's something that we could add into the package in the near future.
But Ken, why not just focus on that in and of itself before trying to overhaul the entire healthcare system? As you pointed out, billions a year in preventable hospital admissions. Why not just, again, piecemeal it? Take it slow, address Medicare, which is already a financial problem for the country, rather than trying to completely remake the entire healthcare industry?
Well, it's a good question. I think the issue is right now, as it stands, the Senate and House have already passed very comprehensive healthcare reform packages. And I think the White House is in a position now to say, how do we move forward to enact those provisions by focusing on some small differences, and they are, they're a small number, but they're big differences between the House and Senate package. They are very aggressive on expanding coverage. I mean, we haven't really talked about why the Republicans oppose this. The main issue, to me, it seems, is that if you're going to do universal coverage and provide health insurance to 30 or 40 million people, many of whom are very low income, it's going to cost a lot of federal money to do it. And that really is the biggest gulf between the Republicans and Democrats, is the scope of the coverage expansions.
Coverage expansion, and if you have more demand for health care but you don't increase the supply, do you wind up with shortages? What will the government end up having to do to keep health care costs in check? I mean, we could go on, Ken. Ken, please, thank you so much for being here, and please come back. Ken Thorpe with the
thanks for having me on.
Ken Thorpe with the Partnership to Fight Chronic Disease. Again, thank you very much.